What are the steps that your company has been taking to prepare?
Well, this is something that hospitals and health systems across the country are prepared for, because this is what we do, is serve our communities. This is a pretty special time, though, because of the unknown. And the unknown right now is really how big is the spread of this virus and how quickly is it going to move forward. And that's really why testing is so important. And that's, quite frankly, a very big frustration that we have.
You don't have enough
on the delivery
tests.
side. Well, you know, this test, we can do a flu test in 45 to 60 minutes and have an answer for our doctors and clinicians and the patients. This test right now, on average, takes 3 to 5 days from the time it's requested to the time the result is delivered, and that's just unacceptable.
My colleague John has a question for you.
So, Brian, how far do we have to go before we get to the point where you think we need to be to get this contained? And by that, I mean get the tests at the level where we have enough of them, get the results back quickly enough that people are able to take the right kind of action quickly enough to prevent the spread?
So today, I believe that the spread is way underreported just because of the inability to get these tests. So we have to make progress as quickly as possible. So, you know, this past weekend, 2 commercial labs started to provide these tests, and that's been helpful. And it's addressed things and maybe knocked off a day. But we've got to work very hard to get these right at the bedside, right at that site of care, so that we can get the same level of result that we get with a normal flu screening. And that's going to be the turning point for us. We hear that that is several months away, but we need to push and push and push on this issue.
Several months away. What are some of the stops that could be pulled to actually make that process happen more quickly?
Yeah. You know, one of the things that the American Hospital Association did over the past couple of days is send a letter to the White House and have conversations with the White House about actually declaring a national emergency. A public health emergency has been declared. That has helped move things along. But what a national emergency does is it clears the decks, often takes away a lot of the red tape and bureaucracy associated with things like how to get these tests produced more quickly so that we can bring them to the bedside. And that's an example of something very tangible that can be done.
Yeah, I think there had been an expectation that President Trump might actually announce a national emergency last night in his address. The fact that he didn't, did that surprise you?
As I said, we had requested that. We weren't sure what was going to happen, and we are still pressing on that issue. We think it's very important.
I think John has a question.
So Brian, what are you telling the staff of the hospitals to do differently as a result of the new data that we've seen come out, the new numbers come out? I think there are a lot of questions about what's going to happen with things like school closures over the next few days. Are there scenarios in particular that the staff is preparing for?
Yeah, the first thing is we prepare for this every day. We are there to serve our communities both at times of calm and times of panic. So what we're doing is following the plans that we have in place. Yesterday, I rounded in many of our clinical areas and talked to staff who are directly caring for patients, and we have had an individual who was diagnosed with this and cared for in our organization. And I talked with the team up there. And one of the most poignant things that she said to me is, I said, "How are you doing?" to the nurse who was caring for him. And she said, "I live to do this. This is why we're healthcare providers." So we have the spirit, we have the talent. What we're working on are the logistics. We need to have enough protective equipment so that when this escalates, our team members are going to be protected. We have to get this testing back, and I hate to keep banging on that, but that is such an important piece because we got to know what we're dealing with. And then we've got to have plans, and we do, to increase the capacity as we see this disease emerge and go through a cycle that it will go through. And we're working on all of that. But the key thing that has to happen, and the president stated this at the end of his message last night, is this is about how we work together. We've got to work with the public health side at the state level. We've got to work at the federal government level. We've got to work with community resources to do this. And the only way you can do that is if you've got information that's available, it's transparent, and it's accessible. And again, that's why we are really pressing on a full team effort here.
Yeah, such a key point. The other piece of this equation, and certainly maybe not one that really folks want to talk about right now, but it is actually factoring into potentially whether people are going to go to a healthcare facility, get tested, and assess their own personal risk, is the cost piece of this equation. And I know one of the steps taken this week was that insurance companies said that they were going to waive co-pays and the costs associated with treating coronavirus, also maybe cover telemedicine. How does that change the dynamic for a system, a healthcare system like yours, given the fact that I would imagine that's going to add more uncertainty, more bureaucratic red tape, or maybe not?
On the ground, we care for everybody regardless of their ability to pay.
Yeah.
So it doesn't really change what we do. Ultimately, there's going to have to be a financial reconciliation on that. So we were encouraged that the insurance companies have taken that step, and we were encouraged that the president discussed that last night.